Rabies is a preventable viral disease most often transmitted through the bite of a rabid animal. The rabies virus infects the central nervous system of mammals, ultimately causing disease in the brain and death. According to the World Health Organization, there are two types of the disease: furious rabies, which is characterized by hyperactivity and hallucinations, and paralytic rabies, which is characterized by paralysis and coma. Although fatal once clinical signs appear, the WHO says rabies is entirely avoidable. Vaccines, medicines, and technologies have long been available to prevent death from rabies. Nevertheless, rabies still kills tens of thousands of people each year. Of the cases, approximately 99% are acquired from the bite of an infected dog. Dog-mediated human rabies can be eliminated through tackling the disease at its source, infected dogs, making people aware of how to avoid the bites of rabid dogs, to seek treatment when bitten, and to vaccinate animals can successfully disrupt the rabies transmission cycle. Rabies is estimated to cause 59,000 human deaths annually and in over 150 countries, with 95% of cases occurring in Africa and Asia. The burden of the disease is disproportionately borne by rural poor populations, with approximately half of the cases attributable to children under 15 years of age. Rabies is exhibited through a variety of symptoms once an animal is infected. The most familiar symptoms are displayed in either the furious or paralytic forms. Furious symptoms include aggression, biting at thin air, or attacks without provocation. Paralytic or quiet symptoms include sickly, dazed, or depressed animals. The most familiar symptom of foaming at the mouth associated with the disease may or may not be apparent, and therefore all precautions must be taken. Safety tips to prevent rabies infection or spread include vaccinating all pets against rabies and keeping their shots up to date, animal-proof your home and yard, store garbage in secure containers, do not feed animals or strays. If bitten or exposed to a potential infected animal, wash the wound with soap water immediately for 10 minutes. Contact your doctor immediately for instructions on your treatment for the potential rabies exposure. If your pet has been exposed, wear gloves to prevent contact with the wound and potentially infected saliva. Contact your veterinarian immediately for further instructions. Rabies is the only vaccine-preventable neglected tropical disease. It is therefore critical for us to protect our pets and remain vigilant. I am Khrystal Wilson with your TTT News Health Check.